legislative priorities, such as increasing funding for senior centers as well as home and community care block grants to assure availability of cost-effective home and community-based services to the elderly. How would you address those priorities? Can we start with you, Mr. Harris?
We can. One of the problems we have, my job, the business that I own, we do, among other things, federal government contracting. And so I see the requirements, both state and federal government, for contracts being put out, for example, for veterans care facilities and elderly care facilities. One of the problems that we have, once again, and this comes back to state regulatory load that prevents smaller companies from filling in smaller and more rural areas, from filling in the gaps that are needed in elderly and elder patient care, veterans care. The government as a state and the government at the federal level are imposing a significant amount of pressure on those providers in regulatory cost and certification of need issues, which we have here as a state, have had for decades and decades. Many states have repealed certification of need requirements. Our state still has yet to do so. These are issues that make it more and more difficult for smaller, more carefully targeted providers to fill in smaller areas, in rural areas, in areas that don't have large cities and large populations. And it puts a strain on our elderly care facilities. It puts a strain on our nursing homes. We need to start eliminating those, and I don't mean everybody run around like it's the Wild West, but we need to start carefully eliminating the regulations that are providing entry barriers and keeping the large corporate entities that control, if you actually look at who owns what companies and what LLCs are owned by who, that actually control the vast majority of all of our elderly patient care facilities. They like it this way. They supported, they lobbied with our legislature, and they gave campaign donations to House members and state senators who voted for these regulations and regulations and regulations, and we need to cut through that.
Thank you, Mr. Harris. Ms. Griffin.
Sure, I have a proper answer for you, but I'm sitting here thinking about the devastation that occurred during COVID-19 in so many senior living facilities, nursing homes, and assisted living places all over the country. We were relatively spared here in North Carolina, but huge numbers of very elderly people died because of where they lived. And I think that as we go forward, we really need to give that some thought and come up with a solution to that problem that should not have been happening. I have spent quite a lot of time in my private life with my parents, my mother-in-law, and then my husband in facilities of where sick elderly people are taken care of. I think that often the private facilities are very, very good, but I'm not sure that I'm prepared to condemn anything around here. I don't know. I just find this to be a situation that's going to get so much worse because there are so many of us boomers. I'm done.
Thank you. Norman Sanders, I'm sorry.
If I could ask, I'm not able to hear what Senator Sanderson is saying. So if he could maybe speak up just a little bit, I'd appreciate it.
All right, let me get closer. How's that? Is that better?
Yes, thank you.
Well, since now that we can hear him even better, we're going to ask Norman Sanderson the same question.
Okay, thank you. I'll be glad to answer that. This is getting closer to home every single year. I'll be turning 70 next year, if God allows me to stay here. And, I see things that, especially if one of the good things that comes out of this pandemic that we are in the midst of right now, it's how do we take better care of our elderly population? Because here in Eastern North Carolina, we are more and more being acquainted with a more elderly population. People retiring, wanting to come to our area, which is a good thing. I think that we have to use, again, a variety of things. I think that we have to partner with the private sector. I think that homes for the elderly, at whatever level of care that they need to be, is probably going to be better if we can make it economically feasible and regulatorily feasible to keep them at smaller levels, 10 to 20 patients in a home instead of 40 or 50 or 75. I would like to see us be able to do that. I would like to see us scale back on the regulations, like Mr. Harris said, because there are some that are, they're really just put there for one reason, and that's to control the numbers and control the market. And we need to look into that very, very carefully. I think that, I've seen how people, when they come to an area and one or the other spouses die, a lot of times they don't want to stay in a home to try to look after themselves. And so we need those kind of facilities that will make it a comfortable place for them to go and feel like they're part of the community and feel like that they're still cared for and that people haven't forgotten them. I think it's very doable, and I think that we need to spend a lot more time focusing on this, because this problem is just going to expand. It's going to keep growing. What do we do? How can we help our older citizens live out the last few years of their life in a comfortable manner?
Thank you. Mr. Bailiff.
Well, I have the going as last. I can say I agree with everyone. I do have 2 years on Mr. Sanderson there, so and I have a whole lot more, as they say, I have a whole lot more yesterdays than I do tomorrows. So it's very important to me to look at that as well. And I do agree that we do have to look at the open market and the regulations on these homes to care for our elderly. Too many times we've seen it become a financial burden for families, which it should not do. We've got to look at the cost of these items and drugs for these people and make it more affordable, and not just give in to the big businesses that come in and put these centers up and dictate the prices. So yes, I'm all in favor of looking at it on the open market and being able to provide good and inexpensive health care for our elderly. We owe that to them as our elders.
Thank you very much. This looks like it'll probably be our last question of the evening, and then we will move to summations. According to the Southern Economic Advancement Project, North Carolinian survey
Can't hear
the 8th to September 7th reported food.
We can't hear you at all.
We can't. Something's happened. We can't hear you.
Oh, I'm sorry. Can you hear me now?
Yes.
Yeah.
Okay. Let me start over.
Please.
According to the Southern Economic Advancement Project, the North Carolinians they surveyed from August 28th to September 7th reported food insecurity and job loss as a pandemic, and noted that help with food, housing, and utilities are needed now. 56% of those surveyed said they were having trouble affording enough food to feed their families, while 38% were struggling with job loss. What can we do to help those people? Let's start with Mr. Bailiff.
Well, that is a huge problem. That there are a lot of hungry people here, and as we've all said on other items tonight, we've got to work to help get these people up out of the hole that they're in, help provide better jobs, better health provisions for them, more affordable health provisions for them. So many times people have to make the decision on whether are they going to take this medicine or are they going to eat a meal. This is not the way we're raised in America, and not the way we've been taught. We've got to help our fellow man to do better and help them, raise them up out of this poverty that they find themselves in through no fault of their own. So many people, because of the COVID, have been forced out of work. They have no savings, nothing to fall back on. We as their fellow man, we've got to be generous and caring and help those people.
Thank you. Mr. Harris, same question.
Food insecurity and life insecurity is something that is very much close to my heart. Growing up, my family was extremely poor, and if it weren't for food banks and co-ops, there were times when we wouldn't have had food on the table. So this is something that I take very close, very near and dear to my heart. The fact of the matter is that the best way to lift people out of poverty, pure and simple, is jobs. If people can go to work, if they can bring that money home, they will put that food on their table. They will pay for the health care that they need. They will build their life if they've got a way to bring in the money to do it. And so we as a state need to focus on having an environment here in this state where jobs can be created. The state doesn't create jobs, governors don't, the legislature doesn't. Our job is to create the environment where we have a free and easy market to create jobs, to start businesses, where we've got people able to produce small business, to build small businesses, because let's face it, 80% of all Americans work in companies with less than 50 employees. Small businesses are the literal engine of our national system. But there are going to be people who, through no fault of their own, fall down. There are going to be people who face food insecurity and living cost insecurity. The government can't fix that. Two of the greatest examples I use, we have one right here in Craven County, Religious Community Services. They provide food bank, they provide shelter for people who are suffering from homelessness. Between them and the food bank of Central and Eastern North Carolina, if you go and you look at their numbers, they do, with a fraction of the money that gets pumped into our Department of Health and Human Services and all of our social service systems, they put more food on more tables and they house more people in their moment of crisis than our government ever has been able to. They are the model for our safety net, and that's what we need to be looking to.
Thank you. Ms. Griffin, same question.
I'm familiar with both of those organizations. I am a big supporter of the food bank here in New Bern and in Raleigh. I think they're doing a fabulous job, but I don't think that they can do the job alone. I think that it's the role of government to support all of us and to treat people equitably. And I do believe that it's programs like Social Security and Medicare and the Affordable Care Act that have improved the lives of so many people in this country since Franklin Roosevelt's time. And I do believe that if we continue to regulate ourselves, govern ourselves in ways that are designed to help people, providing jobs, providing childcare, providing a good education, providing meals for those who need them, to get rid of the I don't know, just to do more for one another than we do now. We're pretty greedy. And I think we could do better if we were less greedy.
Thank you. Norman Sanderson.
Thank you, Tom. You know, I think this has kind of been my theme tonight, but this is a problem. It's evident. It's everywhere we look, and we don't have to go into many grocery stores. We don't have to go into many communities, senior centers, before we run into this square in the face. And, you know, I just really believe that this state, this country, has done a very poor job in educating folks on how to save and how to put aside money for their retirement. And so, you know, first of all, we've got to do that. We've got to educate folks. You know, take $1, if it's just $1 out of every paycheck, just take it and put it aside somewhere so that you allow it to build up. I think we do have to partner more with our organizations that do a great job in helping feed those that are downcast and those who can't afford to feed themselves. And they do. And I think that they do it with the education part of it, that they teach people how to do better, how to buy groceries, how how to do things that nobody's ever taught them before. You know, we have the capacity and the capability to make old age in the United States and right here in North Carolina one of the most exciting times in a person's life, and not wait until they get to a place where they have no options. They're not old, they're maybe too old to go back and get additional training or to get another job. I like to see older people working as a greeter or something in Walmart, but I like to see it because they want to be there just to be able to meet the people that have to be there so that they can buy their medication and also food. And so, yes, we've got a long way to go, and we're going to have to depend on what we can come up with and what God will give us as a plan.
Thank you. Now, this is the time where we ask the candidates to give closing remarks. Each of you have 2 minutes, and we're going to go in the reverse order than when we started at the beginning of the evening. So, Norman Sanderson, can you give us your closing remarks?
I certainly will. Again, I want to thank the Chamber of Commerce and League of Women Voters for being willing to host this tonight. I'm a big supporter of Chamber of Commerce, and I really appreciate the things that the League of Women Voters brings to the attention of not only General Assembly, but of all the citizens in North Carolina. They've got a long list of for their vision, as does the Chamber. You know, I'm excited. I know that we seem like we're in a bad place right now. It just seems like this has gone on and on and on. And when we see a little room for improvement, all of a sudden it seems like we're going in the opposite direction. But this is going to end. And I think North Carolina is set up in such a place right now that as soon as businesses start to reopen and people who have been devastated in these major cities begin to look for places to bring their businesses, they're going to look at North Carolina very strongly. And so I think our future is very bright. There's a lot of things that we need to continue to work on, with education, regulatory reform, you know, the other things that we have to do by law in the General Assembly, create a budget. You know, we're looking at a $2, $3, maybe even higher $1 billion budget deficit this year. And we've enjoyed for the last 6 or 7 years hundreds of millions of dollars of surplus. And now we've got to turn around. Thank goodness that we've passed legislation that any surplus we have, a good portion of it went into our savings. So it's there to help us get through this time that's coming. There's a lot of things we've got to be concerned about. I'm concerned about our children and the time and the education that they've lost. How are we going to help them make that up so that when they get to be seniors or get ready to go to community college, they're going to be at the right place so that they can do that. So there's a lot of decisions that have to be made in the coming years. And I appreciate all of the input tonight. I think it's been very right on, a lot of good ideas, and look forward to serving if the good people in this district will allow me to serve them for 2 more years.
Thank you very much. Mr. Harris.
I would like to thank the League of Women Voters for hosting this. As I said at the beginning, this is one of the few opportunities the voters have to see us. They don't have that many opportunities even in a normal election year. And a year like this is going to be one of the few times ever. And so the fact that y'all are doing this work and that you continue to do this work is important both for us and for the voters. My message to the voters is this: if you are tired of what we've been doing for the last 60 years, doing the same things the same ways, producing the same results, was that thing that Einstein said about the definition of insanity. If we're producing the same results, we're not going to get anywhere by voting for candidates, by voting for politicians, by voting for majorities and minorities in our legislature that are continuing to do the same things, to do them the same ways, and to produce the same results. Now, over the last couple of years, as Senator Sanderson has noted, we have produced a budget surplus, which is a good thing. I haven't always agreed with how we've done it, but the fact that it's there is useful. And those are the kind of things that we need to point to. We need to figure out how to keep that going while not cutting or eliminating or destroying the essential services that we as a state need to provide to all citizens. This is going to take, in our new era, both here in the 21st century and post-COVID and mid-COVID right now, this is going to take a reconstruction of the way that we think. And unfortunately, reconstruction of the way that we think needs to come with reconstructions in the way that we vote. So I'm here to present to you an option that you have never seen before. I'm here to present to you the option of putting in our state legislature a libertarian candidate who's devoted to the principles of small free government, a libertarian candidate who isn't owned by any of the special interests that currently own our parties, and who isn't owned by the leadership of the legislature as it stands, so that we can move forward. Thank you.
Thank you. Ms. Griffin.
Thank everybody who was involved in putting this together this evening. As Mr. Harris said, this has been a very strange year to be a first-time candidate. It's just, I haven't seen very many voters. So I'm glad to be here, and I appreciate the opportunity. I will just simply close by saying, vote. Early voting starts next Thursday. Everybody listening to us and everybody around us should get out and vote this year. It's very important. Thank you again.
Thank you. Mr. Bailiff.
Okay. Again, I want to thank everyone for the opportunity to speak with you tonight. Going forward, you have a big decision to make, and that is one of change. You can stay with the straight party decisions of the last 13 years, many that were made for you and not with you. Or you can move forward with someone who is willing to listen to you, seek your opinions, communicate with you, and support you. In his budget, Governor Cooper has set aside millions of dollars to attract businesses to the rural areas. As I said, that would be my job to make sure they understand this is one of those areas for those jobs to look at. Expansion of Medicaid to help over 500,000 families in North Carolina. As I said earlier, 4,000 county residents and 46 million just into Carteret alone. But that has been blocked by the Republicans. When there's support for offshore drilling and seismic testing, which we didn't even get into tonight, it has been the Republicans pushing that agenda. When teachers are paid minimal wages instead of living wages, that's also backed by the Republicans. Unemployment benefits here in North Carolina were cut to 12 weeks instead of the national average of 26. And that was passed by the Republicans in 2013. Climate change is real. To ensure sustainability of our industries, farming, fishing, tourism, we must pay attention to scientific research and data that will require forward thinking and not just that of political interest groups and supporters. I don't pretend to have all the answers, but I do know this. This position is the House of Representatives, meaning that I am a representative of you, not me or some special interest group, but of the citizens of Carteret and Jones County. Thank you for taking the time to join us tonight, and whatever you do, get out there and vote.
Thank you very much. This concludes our forum. We have videoed this and recorded it, and the replay will be posted on the League's website, which is www.lwvcarteretcounty.org. I just want to tell you all that it's been an honor being your moderator tonight. I think your answers were all very well thought out. And I also will echo what you said. Let's get out and vote. So have a wonderful evening, and thank you for attending.
Thank you.